The first Omicron cases have already been confirmed in the United States in fully vaccinated patients, and President Biden is determined to try to get out in front of this new COVID-19 variant.
We developed this plan, and it doesn't include shutdowns or lockdowns.
Visiting the National Institutes of Health, the US president announced a raft of new measures amid uncertainty about how much harm Omicron will do.
There are 5 key actions that I want to see us take this winter. First is expanding the nationwide booster campaign with more outreach, more appointments, more hours, more times and sites to walk in, providing boosters shots for up to 110 million Americans who are eligible for boosters.
The US is also following some of the 24 countries with Omicron who've imposed travel restrictions. Anyone flying to the US must test negative within 1 day of departure, regardless of nationality or vaccination status, though that isn't required for domestic flights. While the Biden administration is trying to move quickly to tackle this new Omicron variant, there are already mixed messages from some drug makers about their vaccine's effectiveness against it. Pfizer is confident that its vaccine will stand up against this variant, but Moderna is doubtful, and yet it does say it should have a vaccine that's capable of tackling the Omicron variant by March. And the top virologist in South Africa, which first sounded the alarm about Omicron, is optimistic about this variant's impact.
The great majority of the breakthrough infection, in other words, individuals that have had infection despite vaccination, is mild. Our hospital surveillance is showing a little bit of an uptick, but certainly nothing as dramatic as we've seen in the previous waves.
And while 3/4 of all COVID-19 samples collected in South Africa are now the Omicron variant, US officials say they've yet to detect community transmission here, though they warn it will likely take around 2 weeks to detect this. Owen Fairclough, CGTN, Bethesda, Maryland.